Okay, this video is the history of dentistry and medicine. And where this is coming from is I've been reading a lot about dental lately, and I'm like, gosh, it totally reminds me of medical history. In medical history, whenever somebody comes along with a great new breakthrough, just something great, this medical system does not celebrate them. The medical system attacks them. It tries to screw them over, to ostracize them, or they have to shut their mouth. Medicine's not about helping people. It's important to know that as a patient because that gives you a chance to manipulate and navigate the system. Versus if you walk in there thinking the system's going to help you, you're probably going to get chumped. Okay, so let's talk a little bit about dentistry first. Some of these guys wrote great books on fluoride, and fluoride obviously was a fake rat poison. Okay, and it really should not be in the water. Very few countries still have it in the water. It's mostly the Western Christian countries still have it in the water because they're trying to destroy those places. The billionaire perverts, I would guess, are influencing to keep this going. Because anybody with a brain, you can look at the research for just one day and you're like, holy crap, it's an obvious neurotoxin. It makes people apathetic, docile, and stupid and sick. Okay, well, anyways, these guys wrote good books on fluoride. It didn't help them in their careers doing that. Weston Price, was this genius of, he wrote the Nutrition and Degeneration, how populations eating their traditional indigenous diets had good teeth, all of them. And then the ones that eat the processed food, the modern food, the refined flour, the sweets, destroys their teeth. And it also deforms their jaw. They have a lot more kids born with a deformed jaw and narrow arch, crowding of the teeth and whatnot. He also subsequently, very sad story about Weston Price. He did a root canal procedure. He was a dentist and a research dentist, did a root canal procedure in his son, 16 years old, and his son died. And he's like, holy crap, his son died. And then he started to research root canals, and he came to the conclusion it's a terrible procedure. It's always infected, and it causes tons of other disease. It produces a toxin factory because you have this walled-off anaerobic infection that just keeps releasing bacterial toxins into the blood, like the thioethers and the mercaptans. They're bad. Okay, Dr. Patrick Stortebrecher, like from the 1960s, he figured out that you've got bidirectional flow in the veins of the face. There's no valves in them. That's why, when you're a kid, they told you don't pop a zit on your face because it can spread an infection retrograde into the brain, into the cavernous sinus, causing the thrombose. By the way, cavernous sinus thrombosis are super rare. One of the things I do is I'm a neuroradiologist. You know how often I see a cavernous sinus thrombosis? About once every 15 years. Okay, it's rare. What do I see all day long? Diabetes, hypertension, coronary disease, stroke, demented. That's what I see all day long. I don't see this other stuff. Anyways, the relevance of a bidirectional flow from the jaw to the brain was he came to the conclusion multiple sclerosis he thinks is primarily due to amalgams and the root canal procedures causing retrograde flow, traversal of the blood-brain barrier by the toxins or by especially the mercury, and that's damaging the brain cells in the perivenous regions, periventricular perivenous regions. That was his conclusion. And a lot of patients got better when they took out amalgams, took out root canals. So I think it's probably a secondary, less common contributor to the causation of multiple sclerosis, but I do think it causes it sometimes. So the causation can be multifactorial. I think Royce Wank was probably correct. Most of the time it's a gut issue with diet. And that's why his treatment works so well. But don't ever exclude, taking out the root canal or the amalgam as a potential way to cure these patients. They're otherwise probably going to have a lousy outcome and die. Okay, Ralph Steinman, he's the guy who figured out that the blood flow into the tooth generates fluid pressure, extravascular hydrostatic pressure that pushes fluid outward from the tooth. So from the center of the mouth cavity outward through the dentin tubules, fluid is pushed out. That's under normal circumstances. If you drop that flow due to atherosclerosis, due to excessive psychological stress, and also excessive amounts of sweets and refined flour. I don't know why, but they drop flow through those dentin tubules. That'll increase tooth decay. So it's not just a topical question of are you putting sweets and acids and sticky stuff on your teeth. It's also a question of your systemic health. Are you maintaining good outward flow from your vascular system, your arteries, to your dentin tubules to push bacteria out of those teeth? George Meinig, he was a guy, head of the Endodontic Society, was a co-founder of it, Society for doing root canals. And then he realized from the research of Weston Price, oh my God, root canals are a bad procedure. They're all infected. And so he had to say that after being the guy who founded the society to do the procedure, basically. And then they basically blacklisted him, said he's an idiot, moron. Same thing they did to Weston Price. He was the head research guy for major institutions of dentistry. And after he figured out that root canals were bad and all this stuff, They just, sort of blacklist, ostracize. They hate the guy. That's how it works because there's so much money involved. There's millions, even billions of dollars involved. So whenever somebody comes along and shows there's a problem with the conventional way that's making a lot of money, they hate the guy. They do what they can to ruin their careers. Sadly, that's just how it works. It's like I said, the only thing that could fix dentistry and medicine is Christianity. Something that makes you say, I will do what is right. Forget about the money. This is not about money. We're going to do what's right. Just like a parent loves a child, the doctor has to do the same thing for the patient. Say, I will do what is right for my patient. I will not just sell out for money. And that's not easy to do because there's a lot of money. Okay, Hal Huggins, he's a guy who figured out the amalgams were just a disaster and root canals were an even bigger disaster. And he, got in all kinds of trouble. They took his license away. But he did pioneering work, and he removed over 1,000 patients' amalgams for treatment of MS and had a lot of good results, patients who stopped progressing or resolved. He did all kinds of research on figuring out what's going on with these amalgams and how it was much worse with the modern copper filling type amalgam since 1976 that had 50 times more mercury vapor escape from them. Robert Kamal wrote a really good book. Here's his book. I've been going through it, and it's sort of a masterpiece of a book. It's a big honking book, 360 pages, a detailed discussion of dental stuff, but it's a very good book. He's an Australian retired dentist, and those are the guys who write the best books. Old retired guys who don't give a rat's ass because their career is pretty much over. So they're free to tell the truth. A young guy, he's got to make money, pay off his student loans, pay for his house, his wife, his kid. Everything's new and young. He can't rock the boat and risk getting in trouble. He wants to get tenure if he's at a university, so he's got to be a kiss ass. If he, praises the companies, they'll give him some funding. He'll get a little more money. So old guy, he doesn't care. He says, he's been retired for years. He says, here's what happened and here's what it was. And they feel bad too because they know in the beginning of their career they screwed up. They didn't know any better. They didn't know about the truth about what a disaster amalgams are and fluoride and root canals. Boyd Haley, he's an Irish biochemist who figured out a chelator for mercury that actually works. And of course they screwed him over. He can't get funding. He can't publish it. He can't, it's NBMI and it's not allowed to be used because it's not allowed to be a supplement because it actually works, and it's not allowed to be an approved drug because he doesn't have the money to fund it. So it's an orphan drug, meaning no corporation wants it. So even though it works, and even though millions of people, hundreds of millions of people would benefit from that drug, it can't be approved. Welcome to reality. No one gives a shit. All these rich billionaires, and none of them will fund the damn drug. And that's something, it's actually one of the few drugs that's not BS. Okay, history of medicine, you probably know this. I'll just briefly go through it. Ignaz Semmelweis, or maybe I'll make a separate video of this. I'll make a separate video of this so this will just be the history of dentistry.